And joining me on the news from Louisiana is a consultant physician and infectious disease specialist, Dr. Getty Chimbeka Anyanwoke. Good to have you join us, Dr. Anyanwoke.
Thank you for having me.
So let me start by asking you, we've seen several vaccinations across the country. We got reports recently that a number of millions of people have been vaccinated around the world. When you look at that in line with the variants we're also having of this virus, where are we now in terms of trying to curb the virus?
Thank you for having me. It's still at a low stage in a lot of areas around the world. It is true that more than 500 million people, that's 500 and maybe 580 million people or more have been vaccinated worldwide as at this time. And in the US, it's around close to 150 million doses have been given during this period. The issue about the variants is that the B.1.1.7 that originated from the United Kingdom is still, the prevalence is still increasing, and we're finding more and more of that in the United States. We have now gotten variants here in the United States. We have, I think, 2 variants in California, and we have about 3 in New York. And you can see, like, I think the California one is B.1.4.7 and B.1.4.9, and the New York one is also similar. A lot of them are variations as a result of the virus still being around. The more we have people still getting infected, the more the virus replicates, and the more likelihood that the virus can make a mistake replicating, and that results in a variant. The variant may be inconsequential or may be consequential, like these few variants we're finding. The South African one remains the most concerning, also the Brazilian variant. In terms of the vaccination and what's happening is, I believe that the vaccination that we're having here in the United States is beginning to have incremental effect. The problem we're having right now is that some states are beginning to relax the rules, and we're seeing that with some upticks in some areas of infection, hospitalization, and even death.
I just want to quickly jump in, because you talked about some states reopening in relaxing measures in the United States. That's one, but there are also states where, or countries where there is still vaccine hesitancy. The numbers are reducing, but it is still there, and significantly. And if we're going to achieve herd immunity, how do we go about this?
So I think that the medical community and everybody else, the government, the news, focused so much on getting a vaccine and fighting the coronavirus that they did not focus on the fact that there was a lot of misinformation and disinformation out there. And social media, being what it is good at disseminating information, whether it's good or bad. And that's what has overtaken a lot of areas, and you're having this vaccine hesitancy, with people saying the vaccine is going to change their DNA or that there's microchips. And for a long time, people in the medical community were not countering that fact. So what we do now is massive education of the population, and going in depth in the local communities and talking to them, going to people's churches and explaining what's happening and why the information they got via social media was bad information and not correct. So I think that's what is happening right now, and we need to do more of that to counter vaccine hesitancy.
But you also at the end of the day, you also have, just to quickly jump in, you also have a situation where, for example, Germany now just banned the use of AstraZeneca because of blood clots for people over the age of 60. And we've seen that in several countries, and in poorer nations, or middle-income nations where they are benefiting from the COVAX. Most of them get the AstraZeneca, and now there is that skepticism about the vaccine. What should be done to ensure that you don't have that skepticism toward the AstraZeneca vaccine?
The damage, some of it has already been done by that initial holdback. In my opinion, I do not think that the AstraZeneca vaccine had much to do with the blood clots. So out of 17 million shots of the AstraZeneca vaccine that was given in Europe at that time, they had 37 cases of blood clots. If you look at the normal population that did not get the vaccine, you probably have more than 37 in 17 million people. So that's why WHO and even the European Union Medicines Agency came down to the fact that the vaccine probably has nothing to do with the blood clot. But like I said, some of that damage has been done by people being like, okay, we are being cautious. The vaccines are new, and so it's easy to blame stuff on it. And if you compare the rate of blood clots in the normal population, you'll probably find out that it's more than that. A lot of the people that you give the vaccines to first are older people, people with comorbidities, people that are probably moribund, mobility issues. Those people are usually the people that would get blood clots in the normal population. And so that's this, we need to keep explaining it to people, and they should see people getting the vaccines and seeing how many people get blood clots. And that hopefully will alleviate people's fears.
We hope so. We hope that we have more people willing to take the vaccine around the world. Consultant physician and infectious disease specialist, Dr. Getty Anyanwoke, thanks for talking to us.
Thank you for having me.